Well, about 3 years ago, I started having some problems with my knee, and didn't really think it was anything major. So I went to a doctor that was treating my wife for carpal tunnel, and he gave me a couple of cortisone shots, and it worked for a little while. But then it was like candy, didn't work at all. So he introduced me to a specialist. And I went to this gentleman for a couple years, and I had all kinds of treatments, and they told me I had torn meniscus and this and that, and I was too young for surgery. They didn't want to do surgery. So it kept getting worse. And at the time I was working, and I was on my feet 8, 9 hours a day, because I worked in a stock room, and I was running all over the place. And it really got to the point that I just could barely walk. I was actually had more of a limp. I had the PRP done in both knees. Okay. My right knee wasn't really as bad as my left knee, and I really didn't even think I needed it in there. They just kept telling me that it was arthritis, and it was worse in my left knee. So when I talked to Dr. Casasilla, he said, no, we do it in both knees. And boy, I'm glad he did, because now my right knee, I have absolutely no pain at all, and my left knee is just fantastic. If you want to kiss a guy, I would kiss him. That's how good it is. It was to the point that my walking, I couldn't even maneuver stairs. If I did maneuver the stairs, I had to go up sideways or come down sideways. All I had was what was on the internet, what little brochures he gave me, and I thought, man, if this is so great, why isn't FDA approving it and all this? Because this sounds too fantastic to be true. And I came back in about 8 weeks, and I said, I don't think this is working. I said, I'm still having a lot of problems. And I had actually quit work by then. I had retired in July. And I said, I just don't think this is working. And he said, give it a couple more weeks. I'm telling you. You'll notice a big difference. Boy, was he right. And like I said, now I don't run, but I think I could go out and play a decent game of softball, which I love. So, if I was going to say anything percentage-wise, I'd say I'm 90 to 95% healed. I don't know why the public is not more aware of it, to be honest with you. I wasn't aware of it. I never heard of it until, well, actually my neighbor introduced me, and then when I talked to the doctor, he told me about it. And like I said, I was skeptical, and I read the literature. I did all this research on the internet that he provided, and I said, well, I even had my wife come in. I wanted her to be in on the conversation with him to see what she thought, and he reassured her that it would work, and we went home and we talked about it, and she said, go for it. Don't think, do it. Don't waste another minute, because the longer you wait, the more you're going to have that pain. Get in there, get it done, and in that 8 to 12 week period, you're going to really be amazed. Yeah, go home and sit on the couch for a week. Keep some ice on it. Don't climb any stairs, and don't do any bicycling, things like that. Just kind of take it easy for about a week, and then go back to my basic normal routine. And that's what I did. I would tell them first to investigate PRP, because the previous doctors I had, they told me that I would need knee replacement surgery. Now my neighbor that told me about the PRP in the first place, he had knee surgery, and it didn't really work that well for him. He kind of walks sideways, and he wishes that he would have had the PRP done. And he is seriously thinking about having it done on his other knee.